Hi there, folks. Today we are having Rick Olderman, who is a physical therapist, evaluate Matt, who is Bob's son, on some pain issues he's having. He is having some shin splints, some low back pain, and also some hip pain. So, Rick will do some different evaluations, special testing, some exercises. So, if you're having any of these issues, stay tuned. And you can also go to the timestamp section to go to a specific problem you may be having and see what Rick did to help Matt. So, without further ado, here's Rick.
Bob and Brad, the two most famous physical therapists on the internet.
All right, so I just have a few questions. First, from your history that you sent me, you said you've dealt with having tight back that cramped up a lot during college, running age 18 to 21. Was that a unilateral pain? Was it a central pain? What type of back pain was that?
It was just overall tightness. I know there was times where I would like the Cobra stretch, where where you're laying down and my back would tighten up and cramp so much. It was just so painful. So I finally I got a massage for the first time, and it seemed to help for the time being. But I just remember that was always kind of a persistent problem.
Okay, so it sounds like that's a central pain, not on one side or the other.
Yeah, I think just overall.
The next point you made, stopped running collegiately after junior year. I changed up my running form, hoping to use my calves more, and ended up with shin splints, age 22. Why did you change your form?
It was something that, I don't know, I was on the fence of kind of quitting the team anyway, and I just thought I would try to, I'd seen other guys on our team, they definitely ran on the balls of their feet more, and so I thought I would try that, and I don't know if that was the main cause of it or if it was just something else too, but ended up with shin splints. And now it seems like every time I try to get back into running, I deal with the same pain.
And so I just curious about this. Have you tried running on a treadmill with an incline?
No.
I would be curious to see if that also triggers your shin splints. That will give us some information. So that would be a little piece of homework for you to try. Treadmill incline. And I'm thinking like 3 to 5% incline.
Okay.
And then let's try, a mile or 2 or 3 if it's feeling good. But if it's feeling bad, just stop immediately. Have you tried exercise bike and elliptical? Do those also cause shin splints?
I usually don't do those, but those never caused shin splints before.
If we want to be wise about this, we would start with elliptical first for 2 to 3 miles. Or 5 miles or whatever, just to clear and make sure that is an upright, closed kinetic chain cardio exercise that you can do without triggering shin splints.
Mm-hmm.
All right, let's clear that first.
Okay.
And make sure. Okay, yeah, he can do some cardio on his feet. So now it's just going to come down to a matter of form. All right.
Okay.
So let's do that first. And if you just need to do it once, and if you're clear, then go ahead and try that treadmill at an incline test.
Okay.
So next one, started lifting heavy after college, prioritized heavy weight over form sometimes, and that resulted in nagging low back pain. Again, was this unilateral or central low back pain?
I'd say more central. There was never like it's always to my left side. It seemed pretty central.
Oh, wait, those are two different things, though.
So it wasn't always just like my left side. It was it seemed like it was just like, my low back hurts. It's not like, it's always my one side or the other.
Got it. Yeah. Okay, so your right hip has been hurting about a month now. Started the day after you did 10 sets of 10 reps of heel elevated goblet squats with 100-pound dumbbell. Can you demonstrate that goblet squat for me? Is that just
this is the dumbbell?
Yeah.
Heels are elevated. That's holding it like this, and then
got it.
Heels are elevated, but it was on a slant board, so I could the heels are a little bit higher up.
Okay, got it.
And this allows for more mobility to go down all the way, and yeah.
So you were looking for more mobility while squatting?
Yeah, that was just part of the knees over toes program is something that they kind of have assigned in there. So
okay,
I'm doing that.
100-pound dumbbell, holding that at your chest. That's a lot of weight to hold at your chest like that.
Yeah, it's pretty close to center. It's not like holding it out or anything.
Right.
I'd done that weight in the past, and it wasn't really an issue. And
Okay.
I worked my way up over the weeks to do that.
Okay. Can you point to where your right hip pain is?
Yes. Right. See if I can do something to make it hurt. Yeah, I'd say right about here.
All right. And you're pointing just with those two fingers there, right? Not your thumb.
It seems pretty centralized. Like if I do something to make it hurt, I can almost like grab the muscle where it's hurting.
Yeah, yeah. And bending forward, it looks like aggravates it.
Yeah, I'd say like putting. Oh yeah, I can point right where it is, right there. So bending forward, and then if I'm laying on my back and I bring my right leg across my body, that hurts too.
Yeah, and would you say bending forward sitting is worse than bending forward standing?
Yeah, I'd say so.
Yeah, it looks like it, doesn't it?
Yeah.
Okay. Your dad thinks that you have anteverted thigh bones. Would you agree with that? Do you know what that means?
No, I don't.
Do your knees tend to knock inward?
Yeah, like I've noticed if I do like a video of me running, or if I set my phone down and run away, it seems like knees tend to go in a little bit, and heels tend to flare out a little bit.
Okay. We're just going to do, I want to check out a few things here with you, Matt. You ready to get started? Is there anything else you want to add after all these questions I've had?
No, I think I'm all good.
All right, great. Can you put your hands on top of your, do you know what the iliac crests are, Matt?
Is that top of the hip?
All right. So when you watch this video again, you'll see that it looks like your right side is actually higher than your left.
Oh, really?
Yeah. All right. Now, can you find the bottommost rib cage and keep your back to me? Yeah. It also looks like your right rib cage is lower than your left.
Okay.
Okay. But the way it looks to me, it looks like your right side is higher.
Yeah.
Usually that tightness is happening on the side where the pelvis is higher, though, too.
Oh.
Because the muscles that are pulling the pelvis up are the same muscles that pull the rib cage down in most cases.
Okay.
All right. So this is leading me to think something else is going on here. All right. So now let's have you lie on your floor with your head away from me. If your dog doesn't lick your head too much. Down there, Matt, is that painful for that hip to bend down like that?
No, that's fine.
Okay. All right. Now, Matt, I'm going to ask you to bend your knees. Good. And now what I'd like you to do is let both feet fall to the outside. Don't force it, but just, wherever it naturally goes. Okay, good. And now straighten your left leg. Let it fall on the floor. Let that foot. And bring your right foot across towards your left knee. All right. And again, don't force it. So bring it back to center again.
Okay, just let it fall.
Yeah, just let it fall.
I'd say right about there.
Yeah, that looks pretty good. Okay, now straighten that right one. And bend your left. Let's let that one fall too. Okay. Yeah, you don't have much motion either direction, to be honest. Okay. So let's go ahead now and stand up. Okay, now what I'm going to ask you to do, Matt, I don't care which leg you use, but I want you to do a single leg stand from that chair. So you could scoot forward in the chair if you want to. It's up to you, but just pick a leg and stand up. And then sit down. All right, and now the other one.
Oh.
All right. What's the difference between the two sides, in your opinion?
Left seemed easier, for sure.
Okay. And was the right side painful to do that on, Matt, or no?
I didn't feel any pain with that.
Uh-huh. Okay. Now, this time, Matt, I want you to do this while looking in your computer screen so you can see yourself. Go ahead. Do you see a difference in how you're doing that?
Is it how I'm leaning?
Yes. Go ahead and watch, and you'll see that your left shoulder comes way outside your knee. So look at that. And then when you do it on the right side, you stay straight up.
Huh.
Now, I want you to do the single leg on the left this time without letting that happen. I want you to be as straight as you are on the right. That's really hard for you to do, isn't it?
Yeah.
And if you look at yourself in the screen in the computer monitor, you'll see you're not really doing a great job of it.
Mm-hmm.
Go ahead and do it one more time on the right side. See, there's very little, it's a different kind of shift on the right side than the left. It's not great on either side. Let's put it that way.
I know my head's always been all messed up and everything. So.
Yeah, but your left side isn't going to win any awards.
Oh.
Okay. But I would like to watch you do that thigh stretch, if you don't mind.
Oh, sure.
Okay. Yeah. So go ahead and face me like that and just lie back on your back. Good. Now, does that hurt your right hip to bend your knees like that?
Nope, that's fine.
Okay. So pick a side and hold on to that one knee. Okay. And now bring that left knee up. Reset your back. Make sure it's happy. And now hold that left knee as you lower the right. And they do look pretty symmetrical to me. And, you know, as far as big of a guy you are and as much leg work that you do, I'm surprised your thighs aren't tighter than this. Now, go ahead and lower your left one down. And Matt, I don't know if you can see this in the computer screen, but do you see how your left foot is out to the outside a little bit? Can you, see if you can line that left foot up to the knee. There you go. And keep the knee bent at 90 degrees. What does that feel like to you?
It feels like I'm definitely have to force it to hold it there. Yeah.
Now, this time, bring the left knee back up.
Felt like I was using my hamstring to get it there, actually.
Yeah, you definitely have to use your hamstrings to fight against that tightness there. This time, I want you to try and bring the left foot down in that alignment that we're looking for. Stop right there. Stop.
Oh, yeah, I see that.
Already to the outside. There we go. Keep going now. Watch it. Watch it.
Oh, I gotta.
Really likes to go to the outside there. And you'll see that your thighs test a little bit tighter now. This is okay. Now you're going to bring that up, and that takes quite a bit of effort on your part to hold it there. Let's do the same on the other side now.
That seems to be more natural a little bit.
Yeah, you don't look like you're struggling so much on that right side. Try to bring the knee in an inch or two more to center. There we go. That's where I want that.
Well, so hamstring wants to cramp up almost.
Yeah. What does?
Hamstring.
Yeah. So the hamstrings are wanting to cramp because the thighs are tight. Matt, I'm going to ask you to do this stretch, and I want you to do it like this.
Okay.
Okay. And as the thighs get stretched out, those hamstrings won't need to work nearly as much. And I want to fix that. Looks like some IT band tightness there too. Now, I want you to stand up. Let's see. I think we already found out that when you sit in a chair and you bend forward, that hurts your right hip more than when you stand and bend over, right?
Yeah.
Why don't you test that one more time for me? Just make sure that that's still the case.
Yeah, it feels fine. Just bending over right now.
Try it in the chair now.
It feels
a lot different.
Legs in the bent position, it hurts more when I lean forward.
So that seems a lot different than the first time you demonstrated this and had that right hip pain.
Yeah. Yeah, it does seem a little bit different.
Yeah. And I think better. Is that correct?
Yeah, I was trying to find the hip pain as I leaned forward.
Right. Yeah, exactly. All right. I'm going to see if we can get rid of this completely. Now I'm going to ask you to stand up there. Put your hands on the tops of your hips like you did before. And now they look level.
Really?
Yeah. I'll describe to you what we're doing and why that's helping. But I don't think that's the only problem. One thing I didn't check, I'm going to ask you to stand up. I want you to put your hands right on the meat of your butt muscles. So your fingertips are right in the center of the gluteal muscles. Mm-hmm. All right. I want you to pinch both of your butt cheeks together. And now that's your maximum contraction. Do you feel that?
Yeah.
Okay. Now I'd like you to relax your butt cheeks completely. And I'd like you to walk around the house and see if you're getting any contraction happening when you're walking naturally.
There's not much.
Yeah. Doesn't look like it to me. Okay. So now what I'm going to ask you to do is, stay up.
Yep.
Keep your hands on your butt. get up on your tippy toes and walk around on your tippy toes and see if you get any more contraction now.
Felt a little more.
Okay. You should feel like a 5 or 10% of maximum. What this is showing us, why do you think so now do it on your tippy toes one more time there, Matt, with your hands on your butt muscles.
Yeah.
And after about 5 or 10 steps, lower your heels down so that they're touching the ground again too, and see if the butt muscles stay turned on all by themselves, so without you trying to contract them. So you're going to walk around 5 or 10 steps on your tippy toes and then gradually lower the heels. Continue walking and see if your butt muscles stay turned on more than they were the first time you tested.
Feels like a little bit more.
Yeah, that's what we're looking for, Matt. So now we've turned on your gluteal muscles. So your normal way of walking is not turning on your gluteal muscles.
Mm-hmm.
And the technique that we just used is a way that you can start turning them on naturally. Okay?
Okay.
So what is it about how walking on tippy toes that's different than when you're walking without being on tippy toes? Why do you think your butt muscles are turning on in that position?
I'm not sure.
Okay. So what's happening when you're walking, and your dad has probably talked to you about this, is that your knees are locking when you walk. And when your knees lock and your foot is coming, when your foot is advancing, your body is lagging behind your advancing foot. And your knee is locking on that advancing foot when you strike. Those are there. That sets up a condition where your butt muscles don't have to work. But if you walk on your tippy toes, you'll notice that you can't have that foot land in front of you anymore, and that your knees can't straighten either. Those are the two things that need to happen in order to activate the butt muscles correctly while walking naturally. Is that you need to land over the foot that's advancing, and the knee needs to be soft when you're striking the foot. Go ahead and walk around on your tippy toes and see what that, now that you know that that's what you're looking for, make sure that that's happening.
Okay.
And then lower your heels down and walk without your tippy toes and make sure those two components are still occurring.
Yeah, this felt like a similar benefit that the taping had too, right?
Correct.
Forces legs to not be straight when I'm. I definitely notice myself taking smaller strides too.
Exactly. Right now, your hips and pelvis don't know how to take longer steps while having proper alignment.
Yeah.
But the more that you practice this, I mean, you can take 5 foot long steps if you want to, and still have proper alignment. So, and that's what running is basically. Running is keeping that alignment. You can't run with your foot advancing with your body back behind it, right? Your whole body is over that foot when it strikes the ground, but you're not doing that when you're walking. And we spend, 99% more time walking than we do running. And so the walking is setting your running up for failure. Okay, so we're going to fix the walk, and we're going to see how this translates over to your running mechanics too. I really want you to focus on the walking and get that butt turning on. And one of the reasons is you may have something called an anterior femoral glide syndrome in that right side.
Okay.
And so what that means is that the hip bone in the socket, all right, is sliding forward in the hip socket as you're bending that knee. The reason that happens is because the butt muscle isn't getting turned on to control it. So not only do you have the tight thigh muscles, and I believe you have very tight IT bands, but you also have poor gluteal function. So we're going to fix those two things. You'll notice that when you stand, you have a wide base of support.
I guess I never really noticed before. But
Now bring your feet in so that they are in line with your hip joints. And you'll feel that that's kind of uncomfortable and takes some effort on your part.
Is that how I should always be standing?
No, it's not necessarily, but this is a way that you can start stretching out the IT band.
Okay.
Is by just, every now and then bring your feet in closer together. Your feet are wide because your IT band is too tight. It requires more effort to bring them into alignment with your hip, just like that stretch on the table.
Yeah.
It took a lot of effort to bring that leg in. You're fighting against that IT band.
Okay.
All right. And it's being reinforced with your walking. And I'm reluctant to tell you to stand and walk like that from now on, because that'll be a huge biomechanical change for you. But I think it would be good to do it periodically to start seeing how you respond to it and seeing whether that starts to increase any kind of aches or pains And if it does, then we have to go slower with this kind of change.
Okay, because when we did the taping, it seemed like I did that for 3 or 4 days in a row, and I felt great, honestly. Like, it didn't really seem to hurt at all.
Yeah, yeah. So the taping is showing us that when we can activate that glute, we have better tracking in the hip socket, right? But the taping isn't solving the tightness issue. And we found out that the tightness issue takes your pain away.
Yeah.
When we solve that. So that's why I think we have two things going on here. Okay, the last thing is I want you to stand up again. Yeah, that's perfect. Now lift up 1 foot just a half inch, and I want you to be as tall as possible. In fact, when you're standing on that left side, to prevent you from leaning over, I want you to bring the left arm up overhead. Now that's going to help you force proper alignment when you're standing on that left leg. And now with the right leg, you can straighten the right leg. I just want a quarter to a half inch off the floor. And you're going to bring that right leg out to the side about 5 to 6 inches, and then back to center. And keep doing that 15 times. Now your left knee should be soft right now. There you go. Bring that right or left arm up overhead a little bit more. There we go. That's going to force, see how difficult that is?
Yeah.
That's forcing the left hip muscles to work the way they should. Your right leg is going out to the side too far. There it is, just there. Make it easy. We're going to do that 15 times. Now stand on the right. We're going to do the same thing. Watch yourself in the screen and make sure that you're not leaning to the right. Because when you run, we want you to be upright when you run, right? You don't want to be running like this.
Yeah.
So that's what this is training, is an upright. Because we found when that single leg stand from the chair, both sides are wobbling. Now, again, on the left, and as long as you're not leaning over, you don't have to have the arm up in the air. But look, this left side really wants to lean.
Okay.
Getting a little burn?
Yeah.
Good. Where's your burn?
I was feeling glutes actually a little bit.
Yes. And the side of the hip should also feel a little burn. Okay. So what you're doing right now, you're strengthening the left hip abductors. So now you're strengthening the right one. So the leg that's moving isn't doing anything other than delivering a force to the opposite hip. And that opposite hip, the stance hip, has to try and stabilize that whole system. This is the third exercise I'm going to ask you to do.
Okay.
All right. And you're going to do 3 sets each time you do this of 15 reps.
Okay.
Now, especially for someone as strong as you and an endurance runner, really surprising that this weakness is here. All right. So I'm going to assume that because you have so much weakness up in the hips and the tightness of the IT band, that your shin splints are likely related to a compensation pattern for this weakness. All right. So that's all I've got for you for now. And then what I'm going to ask you to do is just stay in touch with me. Every 3, 4 days, 5 days, whatever. Let me know how things are progressing, whether your pain is diminishing. And what I'll really be interested in is, are you seeing improvement with your ability to do the exercise as well? Is it becoming easier? And I want to, that's the big question. And then that in combination with, and my pain is going down, or my exercises are much easier, but my pain is not changing at all. All right.
Yeah.
And if that's the case, then we're on the wrong track and we need to start looking at some other things.
Okay. Yeah. I'll make sure to be aware of both of those and keep track of those.
Great. I'll send you a little email with this stuff and a little synopsis, and then we'll go from there.
All right. Perfect. Well, Rick, thank you so much.
My pleasure, Matt.